Hello again. Welcome back. My name is Dr. Peter Din, and I'm the owner of Atlanta Dental Team. And today we're going to have a discussion about gum disease and periodontal disease. What is it? So basically, inside your mouth, there's two types of bacterial ecosystems that can cause damage to your mouth. Okay? One is the bacterial ecosystem of cavities. The other one is the bacterial ecosystem of periodontal disease. Okay. You may notice that if you don't brush your teeth for a couple days, week, you may find that your gums start to get irritated. Gingivitis starts to happen. Gingivitis is inflammation of the gingiva. Itis is inflammation. Gingiva is gum tissue. Stage one is your gum tissue being inflamed. Over time, if your gum tissue continues to be inflamed, your body is basically having a war zone at the site of where your body meets the environment. The environment is full of bacteria, and so your body sends out basically cells to fight those bacteria. As a result, the war zone creates damage around the area in the form of your bone getting destroyed and the tissues that make up the area get destroyed. If you have gum disease, if you have gingivitis, over time, the trauma causes something called periodontitis. Itis is inflammation. Periodont is the periodontal tissues of the tooth and the gums and the bone around the area. Having inflammation of that around that area causes you to lose bone, basically. I know there are a lot of dental geeks out there that may correct the exact definitions. Just to keep it simple for today, you're going to lose bone. All right. Over time, if you lose bone around your teeth, you will basically start having wiggly teeth. The teeth starts to wiggle over time, and eventually you lose the teeth. Periodontal disease is the #1 cause of tooth loss. And so if you live long enough, or if you have a dirty enough mouth, you could be losing a lot of your teeth from periodontal disease, or if you haven't gone to the dentist for a long time and got teeth cleanings. So basically, in your saliva, you have calcium in your saliva, and basically the bacterial colonies that live inside your mouth absorb the calcium and harden over time. So in an X-ray, you can start seeing little sharp areas on the X-ray that kind of stick out, little spicules that stick out at the necks of the teeth. And the body basically shies away from those areas, and bone starts to be lost around those areas. The treatment for that is basically a gum infection therapy, or a scaling and root planing, or a deep cleaning. These are all terms that are synonymous. So basically, when your gum tissue starts to get more and more inflamed and you lose bone, the gum tissue starts here and the bone might start here, but eventually it starts shrinking away. So that distance, that depth, is something that we measure in the dental field. A healthy depth tissue is between 1 and 3 millimeters. Unhealthy is 4 or more. Above 4 millimeters, whenever you brush and floss your teeth, you're basically not cleaning underneath those areas. So if you have periodontal disease and you have gum tissue that are 4, 5, 6 millimeter pockets, it's almost like you've never or haven't brushed and cleaned that area for days, weeks, months, maybe even years. Imagine yourself not brushing your teeth for years. You can imagine how bad the breath might smell. You can imagine how much bacteria is growing in the area. So this is why we have a profession in the dental field. It's because it's impossible, it's physically impossible for you to clean underneath your gums, and you need a specialist. You need a dental hygienist or a dentist to clean underneath your gums. No problem. You just gotta come in for a teeth cleaning, you know? It may cost a little bit more if you've missed a couple cleanings. You know, we wanna do twice a year at a minimum. And so if you missed a couple, sometimes it takes a little bit of extra work and money to get you caught up. Good news is we can get you caught up. It just takes time, money, and energy to get you caught up. Hopefully you haven't lost too much bone as a result, but the lesson here is that you need someone with a metal instrument or a laser to mechanically clean out and flush out those areas where the bacteria have grown so that you can heal up. So you can go from a 5 or 6 millimeter pocket back to a 3 millimeter pocket. Now you can actually clean your teeth. Now you can actually brush and floss. And when you do those actions, they're actually cleaning out your mouth. But if you don't have a 3 millimeter pocket, the brushing, the flossing, while it helps reduce the total amount of bacteria in your mouth, the bacterial load in your mouth, you're not cleaning underneath the gums. So that's where, that's why we have a profession. That's where we can help. Okay. So if you notice that you have sensitivity in your mouth, if you notice that your gums are bleeding, if you notice that you have kind of a funny odor in your mouth, it's quite possible and most likely that you need a gum infection therapy or a cleaning of some sort. Or if you haven't been to the dentist twice a year, these are some signs that kind of can show that you have that gum disease, that periodontal disease. Hopefully this was helpful for you. Go see your dental professional if you have some of these signs and symptoms, and best of luck. Good luck on your tooth journey, and I hope you have a healthy and happy journey there. Take care.